Alright, nursing rock stars, let us jump in with an NCLEX question for a challenge. Imagine a patient with bipolar disorder who has been on lithium. After several days, you approach the patient and ask about the patient's feelings. The patient replies, "I feel fine now, I do not need lithium anymore." What stage of the nursing process is being demonstrated, and how should you respond? Stay tuned for the answer. The nursing process, ADPIE, or ADPIE, is the golden ticket for psychiatric care on the next-gen NCLEX exam. ADPIE provides a systematic roadmap to guide care decisions, regardless of the challenges presented by the patient. Let us review each step. First, assess the patient. This phase involves gathering a complete picture of the patient's mental status. Use the mnemonic MASH. M stands for mood, A for appearance, S for speech, and H for hallucinations. Evaluate the patient's mood, determine whether the mood is flat. Examine the patient's appearance, observe if the patient appears disheveled. Assess speech, determine if the patient speaks too quickly, too slowly, or not at all. Identify any hallucinations, ask if the patient hears voices or displays signs of visual hallucinations, such as sudden darting movements. Utilize standardized tools such as the PHQ-9, a 9-item patient health questionnaire for depression, or the GAD-7, a 7-item general anxiety disorder scale, for a quick mental status exam. Note that the PHQ-9 is designed for adults, while the PHQ-A is the appropriate form for adolescents. Complete the assessment thoroughly. Next, establish at least one NANDA nursing diagnosis. For example, assign risk for self-harm if the patient expresses dark thoughts, or ineffective coping if the patient is overwhelmed by stress. The next-gen NCLEX exam provides a drop-down menu of options. Therefore, become familiar with common psychiatric nursing diagnoses by reviewing additional resources. Moving forward to planning, set SMART goals: specific, measurable, achievable, relevant, and timely. For instance, plan for the patient to verbalize 2 coping strategies by the end of the shift. Ensure that the goal is clear, measurable, and attainable. After planning, implement the care plan by using therapeutic communication, administering medications, and performing regular safety checks. A helpful mnemonic for this phase is START. S represents safety first, T stands for therapeutic rapport, A means administer treatments, R denotes regular engagement, and the final T signifies teach coping strategies. If the patient becomes agitated, de-escalate by calmly asking, "Tell me what is going on," while using therapeutic communication techniques. Alternatively, administer a scheduled dose of lithium or PRN anti-anxiety medication if prescribed. Always prioritize safety by removing any objects that could be used for self-harm or harm to others. Screen every patient for suicidality and homicidal ideation, and inquire if a plan exists. Suicide prevention is an important topic that will be addressed in a future discussion. Finally, evaluate the effectiveness of the care plan by asking, "Did my plan work?" Reassess the patient's mood using the original assessment tools such as the PHQ-9 or GAD-7, or consider using another standardized instrument like the Beck Depression Inventory, which the patient can self-score. Verify whether the patient is still refusing medications, and consult the physician or review PRN orders to adjust the schedule or dosage as needed. If the patient remains agitated, request assistance from coworkers, the manager, or other medical staff. Psychiatric nursing can become dangerous quickly, as patients who are not physically restrained may inadvertently create unsafe situations. Returning to the opening question, what stage of the nursing process is demonstrated when the patient reports, after several days, that the patient feels better and no longer requires lithium? In this scenario, the bipolar patient refusing lithium is in the evaluation phase. The evaluation phase involves determining the outcomes of lithium administration, a process that often requires several doses over a period of up to a month before noticeable effects occur. Although the patient reports feeling better, no SMART goals or outcome measures have been established. The patient's statement that lithium is no longer necessary reveals a significant knowledge gap. Provide education and perform a nurse-patient evaluation to determine why the patient feels well and how to maintain a stable mood. Lithium helps regulate mood fluctuations, so engage the patient in a discussion about the importance of continued treatment. Explore the patient's refusal therapeutically, perhaps the patient dislikes the side effects, and reinforce the importance of adherence. A suitable nursing diagnosis in this case is non-compliance related to lack of insight. Reassess later to verify if the patient has taken the prescribed dose and is following the care plan. ADPIE is the backbone of systematic, patient-focused care, exactly what the NCLEX exam demands. Excellent work. Subscribe to Yes, You Can Master Your Nursing Licensure Exam for more resources. You have truly mastered the nursing process in psychiatric care.